I would like to extend our warm welcome to our guests, Mr. David Rowe and Mr. Extend my appreciation to our faculty CG working in our rehabilitation,
Change the quality.
education. Neuromuscular therapy is one of the comprehensive and source of anesthesiology education that can be available for our clinicians, especially physiotherapists. Also, I want to thank Mr. David and also Mr. Danny for taking the time to come and organize this workshop for our Aimst University. Thank you very much. I think the neuromuscular therapy, I think I have read a lot of articles from our website, and I was published in even in the PubMed website. You can see. I think Mr. David has published a few books on neuromuscular therapy, and also some of the articles published on because of the doing the book study and the experimental study, and prove that the neuromuscular therapy is a very promising, low-cost intervention to treat our neuromuscular condition. So I think this is one of the things that modality that physiotherapy can think of in dealing or in treating our neuromuscular problem. But it's also other conditions, not only the neuromuscular, even like the condition like even the trauma cases or fracture cases, also they are quite useful. As I see in this article, this is being published. And I think the concept of neuromuscular therapy, and as what Mr. David put in his book, he said that there are actually combinations that using a mechanism of compressive and decompressive effect stimuli to obtain the positive effect on our musculoskeletal problem. I think they are using this concept, this mechanism in treating all these problems. So I think as a clinician, future physiotherapist, I think we should also learn extra techniques rather than only our conventional physiotherapy management. Many of them know, I think in our curriculum we know all the conventional things. But these are the extra things that we actually should also learn. Not only this one, it can be acupuncture, it can be acupuncture, all type of techniques we can learn. And this will be a good advantage for us when we are in the clinical area. Because you deal with all type of patients. And this patient, they can be even from the from the stroke patient until the cancer patients. Even the infective problem patients also can be used. So I think that there is a potential for this type of technique to be taught in the university. Because I see that they say they have already been executed in some of the university, especially in Italy. Italy, I don't know about it. Oh, I don't know about Australia?
Australia, no.
No. But Italy and some of the countries. Indonesia, yes.
Yeah.
Indonesia. Maybe we can talk of the elective paper of maybe they organized in our university. So I think from what I've seen from the study, I see that the correct applications of this neuromuscular therapy is very important. Correct application. That's why today they are here to teach you the correct technique. Maybe what you see from the book, you just follow step by step, maybe it's not the correct method. So today, Mr. David and Mr. David will show you the correct method of application. So the multiple conditions can be used, you see. They explain that. I hope that more publications can come up to support all this evidence. Because we are talking about evidence practice. So here again, I don't want to take so much time on talking. So I'd like to convey again our appreciation to our students for able to come forward and participate in this talk. Because without students, I think our workshop won't have so many participants. But we are actually we are not opening to the outside, to our alumni. The alumni also request, but we cannot cater for alumni because the number is limited. For the next time, maybe we can cater for our alumni. So, and also some of our professional staff also can participate. So, Again, I'd like to thank our committee here. They have been working so hard in organizing and shifting the cards from the down from our left up here. So I thank everyone for the cooperation. So I hope all the participants will enjoy the workshop, the 2 days workshop, and I hope you are able to gain the knowledge and skills, and able to apply in your future capital. Thank you so much.
Guys, we are going to take a group picture. This is from behind. One this way, one this way. Yeah. One. Take one. This way, one sir. Come. Okay, 1, 2, 3.
Semua asyik kontinau.
Okay, you can give me with this. Yep. How come it's delayed? Yeah, it's fine. 10 second delay. 10-second delay. Yeah. Maybe more than 10 seconds. Yeah. Okay. Do you have some scissors? Have some scissors or some tape? Oh, okay. Okay, fantastic.
This is very important.
A good skate.
Yep. Okay. 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 Fantastic. Okay, there you go. Okay, good morning everyone. Okay, my name is David Blow. I come from Sydney, Australia. My background is in traditional Chinese medicine from University of Technology in Sydney. So that is my background, my degree. Okay, so my degree is in acupuncture and Chinese medicine. As your dean was saying before, acupuncture is also a treatment option for physical therapy, correct? Okay, and so this is the case. This is the case in most countries in the world. Okay, Australia included. Not for Italy. Italian physical therapists cannot do acupuncture. So dry needling in Italy is not a part of the techniques that a physical therapist can use in Italy. Interesting, yeah? So it depends upon which country you're in. Okay. So, anyway, let's just talk a little bit about acupuncture. That's okay? Acupuncture? Because in acupuncture, in Chinese medicine, you have two types of stimulus. Correct? Someone knows a little bit about acupuncture? Two types of stimulus. One is tonification, and the other is dispersion. Tonification, dispersion. So they are opposites, correct? Okay. Chinese medicine is about opposites. Yin and yang, male and female, day and night, hot and cold, blood energy, internal, external, superficial, deep. Yeah? And so these are also concepts that we use in physical therapy. Superficial problems, deep problems, neurological conditions, blood vascularity, lymphatic conditions. And so, taping. What do you mean by taping? What is the objective when you apply a tape? Yeah? There must be an objective, yeah? My English is okay for everyone? Yeah, you're following? Okay. We must have an objective. When we apply a tape, when you're applying a bandage, let's just change the terminology. What's a bandage? A bandage is synonymous to what? Compression or decompression? Bandage is compression, yeah? Okay. So if you have an ankle sprain, lateral ankle sprain, you go to hospital, emergency ward, what do? Compression technique or decompression technique? In the acute phase, compression, bandage. They will take an X-ray, make sure you have no fracture. If there is no fracture, what is the treatment in emergency? Compression, bandage, constriction or dilation. Constriction, okay? Because that is the acute phase. In medicine, we have three phases. We have an acute phase, post-acute phase, and what's the next phase? Functional. Acute, post-acute, functional. When we talk about rehabilitation, when we're talking about assisting the healing process, because we're all here today because we want to assist in the healing process, yeah? Acute, post-acute, functional. So in the acute phase of lateral ankle sprain, acute phase, the necessary techniques are compression. You want more blood circulation or less? In the acute phase. More or less? Less in the acute phase. Because maybe you have hemorrhage. Maybe you have excessive edema, correct? But you have trauma. So in the acute phase of trauma, the treatment is always compression, but that is emergency. When we start the rehabilitation of an ankle sprain, the rehabilitation, what is our objective? Our objective is to increase the oxygenation to the trauma site or reduce. Increase or reduce. Increase oxygenation, increase blood circulation, increase drainage, reduce pain, and to encourage the healing process of that trauma, correct? So, is there a physical therapist in the emergency ward in hospital? No. Because rehabilitation starts in that acute phase, in that case, no. But maybe there is also space for a physical therapist to work in, okay, in the emergency ward. You have a patient who comes with lower back pain, acute phase, lower back pain, yeah? So there's no real trauma, lower back pain, okay? So we have muscle contraction. And so usually what happens in hospital is, you go to hospital with lower back pain. You have a red flag, yellow flag, black flag, hopefully not, or you have a green flag. You have a green flag, which means you're going to be one of the last ones treated in that day, correct? Okay, but the patient has pain. They have pain, they have suffering. So it is not a life and death situation, but physical therapists can assist in that patient very quickly. Once the doctor obviously has done a certain diagnosis and they eliminated certain conditions. So, even so, in emergency, we can use tape for lower back pain, okay, in the acute phase. Okay, but anyway, so this morning we've introduced a tape which can do two things. A tape which can do compression, and the opposite that does decompression. Compression, decompression. So there are two opposites, not the same, they are opposites. Yeah? One is going to be constriction, the opposite is going to be dilation. Dilation, constriction, compression, decompression. Ischemic, blood circulatory. Okay. So we're going to be using two different ways of treating based upon our diagnosis and based upon creating a treatment objective. Okay. So you see these images being projected, okay? So what can you notice about these images? Okay, so they're all colorful tape, okay? You can see the tape is applied, okay? Applied in different areas, okay? Pediatric on the forehead, the knee, lower back, on the elbow, face, various areas. But what do you notice? Okay? It's all interesting, but it has to have a certain objective, yeah? What's the tape doing? That is what you have to ask, okay? Oh, wow, look at that tape, it's colorful. Just because it's colorful means it's going to work. No. Has to be doing something. Okay. So mechanically, the tape is going to be doing something. Now repeat, the tape can do two things. One is constriction, and the opposite is dilation. So when a physical therapist uses their hands, like manual therapy, right? What are you doing with your hands? You're doing constrictive technique or dilation techniques with your hands. Your hands are doing constriction or dilation, compression or decompression. Your hands are doing decompression. When you do a connective tissue massage, okay, so what is your objective? On the skin, going towards the muscle. When you want to treat the muscle fascia, for example, and you're using manual technique, what is your objective? To increase the blood circulation to the muscle fiber or reduce? Increase, okay, your objective. Maybe you have a stroke patient. When you're treating the shoulder in a stroke patient, you have the skin stuck to the connective tissue, stuck to the muscle fascia, stuck to the deltoid muscle, and not much is moving, correct? And so the patient has pain, reduced range, compression over the brachial plexus, compression, reduced oxygenation to the nerve fiber, to the muscle fiber. Okay? A stroke patient, you hold the arm is hot or cold in a stroke patient? Is it going to be hot? No. Nowhere in the world it's going to be hot, even though it's hot. Okay, it's going to be cold. How come it's cold? Because we have spasticity, we have rigidity, we have retraction, but mostly we have mobility or immobility. Immobility, and immobility always increases blood circulation or reduces? Reduces. So, consequently, you have an upper extremity, lower extremity, cold, and you want that muscle fiber to work better. Yeah? You want it to respond better, if it can respond, obviously. Okay. And so, if you want the muscle fiber to respond better, what shall we need to do to that upper limb? Ischemic stimulation or dilation stimulation? Just from a blood circulatory point of view, we have to increase the blood circulation, correct? Okay? Increase the oxygenation. Every time your muscle contracts, you consume oxygen, yes or no? That's what science tells us. Science tells us that every time we move, we are consuming oxygen. So, you have a certain immobility, okay, the diagnosis. We have a certain central nervous system condition, many different types of conditions, obviously. Okay, we have various levels of paralysis caused by different areas of central nervous system trauma. But from a rehabilitation point of view, one of the keys in the treatment of a patient is increasing the oxygenation to the area, to the foot, to the Achilles tendon, gastrocnemius, all of the muscle fiber in the lower and upper extremity, as well as occipital area and lumbar area. So, neuromuscular taping, compression or decompression in a stroke patient is going to be 100% decompression. Okay, we don't have a sport trauma. Sport trauma is something different. Sport trauma, you have a reasonably healthy person, you have no neurological condition, no neurological trauma. It is a mechanical muscular joint trauma, and so consequently we are going to be applying a tape, acute phase, post-acute phase, and functional phase, using different stimulus. So I think today we have a stroke patient. Okay, so we'll be analyzing the stroke patient. We'll be seeing, okay, we'll be doing an evaluation, very quick evaluation of the patient. We're going to very quickly analyze a therapeutic objective, and we're going to be applying the tape, and we're going to verify immediately whether there is a result, yes or no. When you apply a tape, neuromuscular tape, you expect a result pretty quickly. Okay. So what is the difference between neuromuscular taping? Neuromuscular taping is called NMT, and other types of taping. You go onto YouTube. YouTube is a big area where you can not learn many things, let's say. Okay. Okay, you go onto YouTube and you see many taping applications, many taping applications. Okay. And you will usually see compression techniques. Compression, not decompression. Because we don't put up decompression films. We put up various experiences. Okay? I'll show you, I'll connect later on. I'll connect later on to the internet and I'll show you some things which are available. Okay? So, compression or decompression. So when you look at the images, like that image there on the knee, okay, or that one there, or that one there, we get back to that one. So for example, this is a knee, okay. This is after a knee ligament operation, reconstruction of the anterior ligaments of the knee. And so you see there is a bandage over the scars, okay, over the surgical site. You see a bandage, okay. But you see the tape, okay. You see how the tape is cut, 5 centimeters or 1 centimeter. In this case, it is 1 centimeter. It's not 5 centimeters, it's 1 centimeter. So what is the difference between the different sizes of the tape? Okay. All the tape is 5 centimeters, okay? Okay. We use tape in speech therapy. In this direction. No, okay. So 5 centimeters wide tape. 5 centimeters wide. The wider the tape, the more bandage technique or decompression technique. What do you think? The wider the tape, the more constriction or the more dilation. What do you think? More constriction, yeah? Okay, so you see here, after the operation, after a knee ligament operation, what are the symptoms going to be? What do you think the symptoms are going to be? We have 5 symptoms. First one is going to be pain. Second, edema. We say edema and not swelling, okay. Edema. Next one, hematoma. Bruising, hematoma. Next one, number 4, inflammation. Okay. And the last one, mobility or rigidity? Rigidity. Okay. So after any surgery, any place in the world, any surgeon, you're going to have 5 symptoms. More or less, but you still have 5 symptoms. Okay? After the surgery, pain, edema, hematoma, inflammation, and rigidity. Okay? And so these are the 5 symptoms that it's your job to fix. Physiotherapist is about fixing the problem, helping the patient to get better. Because the surgeon has cured the patient, yes or no? The surgeon has not cured the patient. The surgeon has put the pieces back together again. Okay? Has reattached the ligament, reattached the tendon. has taken a piece of tendon from somewhere else and put it there. Okay? Surgery is a fine art, but it puts things back together. Okay? And so what happens after the surgery? The person is 100% cured? Not. After surgery, we have 5 symptoms: pain, edema, hematoma, inflammation, rigidity. Young or old, expert surgeon or less expert surgeon. Okay? We're always going to have the 5 symptoms. Okay? From New York to Kuala Lumpur to Sydney to people are always going to respond. And so it is your job to reduce the pain, normalize the mobility, reduce the edema, get rid of the hematoma, and reduce the, improve the mobility and reduce the inflammation. So, what is the tape doing? You see how the tape is cut into 1 centimeter strips. And you see how the tape is? When you see a tape which is wrinkling like this, it's called wrinkling tape. When you touch the tape which is wrinkling, you already know it's going to be soft or hard. When you touch the tape which is wrinkling, it's going to be soft, soft, soft. Because without the tape, okay, after surgery, the knee is going to be soft or hard. Hard because we have edema, okay, rigidity, we have pain. When you have pain, usually the body becomes tight, yeah? Tightness of the quadriceps muscle after the knee surgery. The quadriceps is going to be tight, okay? And so also reducing the mobility. And so the surgeon is going to say, improve the functioning of the quadriceps muscle. How do we improve the functioning of a muscle fiber after surgery? Compression, constriction, concentric, or dilation, decompression, eccentric. They are two opposites. So you want to improve the functioning of a muscle fiber. So here, to reduce the edema, we have to apply a tape which is not constriction, but it is dilation. And so you see how the tape is on. And so we have to activate the tape. And so we have to activate the tape through manual activation. Okay, we'll see later on. Together with movement. We apply the tape and we get the patient not to do exercise so much, but to walk. More movement, more flexion and extension of the knee. The tape is going to wrinkle less, wrinkle more, wrinkle less, wrinkle more, wrinkle less, wrinkle more. Creating a pumping mechanism, as we see here. Anterior to the knee and posterior to the knee. This is a pediatric, okay? So the patient has some central nervous system problem, okay, a developmental problem, okay, and consequently has difficulty in speaking, swallowing, coordination of the saliva, okay, so it has a drooling chaturanga problem, okay. How can we help the patient control the swallowing, control the coordination of the saliva? Again, what do you like this? That's going to stop them drooling, yeah? But not our objective. So here we're going to be applying the tape. The tape is proprioceptive. It's going to be creating a proprioceptive stimulus. Yeah. Anything on the skin is going to create a modification of how you perceive the reality around you. Anything on the skin. But we have to look at proprioceptive stimulation in two ways. Correct or incorrect. Positive or negative stimulation. So, we have a child, maybe a Down syndrome, maybe a developmental, maybe a CP patient, okay? And so, what are the lips going to be like? Hot or cold? Now, sometimes in physiotherapy you don't even ask the question, or you don't even think about it, okay? What's the lips going to be like in a CP patient? Warm or cold? Pale or what is the color of hemoglobin in transparency through our skin? Okay, it's going to be like our lips, okay? Most of our lips are pink, okay? Someone who has very pale lips, what can we say? Can you say something if someone has pale lips? Let me see your tongue. What is the color of your tongue? Black. Purple. Serious problems. Red. Red is going to indicate what? Excessive blood circulation. Okay. Pale white. Reduced blood circulation. Pink. Yeah. Pink is perfect color. Okay? So if you have a CP patient, look at the color of the lips. Okay? Usually in physical therapy, it's not part of the evaluation, but okay? But it is rational that you look at. So, okay, usually a child is going to have pale lips, pale tongue. You touch the skin, and the skin is going to be cold. Okay? Which means what's happening locally. Okay, so to the mechanical receptors around the lips. Okay? If we have a cold situation, we have a improved mobility situation or reduced mobility. So, in this case, we are cutting a tape. We're cutting a tape which is 3 millimeters, which means this tape you have to cut into 16 parts. 16. You have to cut it into 16 strips to get to that size. Which means the narrower the tape is, the more superficial or the deeper? Superficial, okay, excellent. So the narrower the tape, the more superficial. The wider the tape, deeper. So if you're going to be applying the taper to lower back pain, the tape is going to be 3 millimeters or 5 centimeters. 5 centimeters, correct. Oh. Can we fix up the... Okay, so for example, this is about the scar treatment, okay? Okay, amputation of the... Maybe just put the sound down. Okay, maybe that's a little bit better. Okay, so this is a lower limb amputation, okay, above the knee. And so we have scar. And so the scar after the operation is always going to be adhesion or it's going to be normal. The skin is going to be normal or adhesive. It's going to be adhesive. The scar is always adhesive, okay? And so, for example, in this case, you just see here, okay? You see how the person is stretching the skin. And so stretching the skin up until a certain limitation, you can see. Okay, we're going to be seeing the second treatment straight after. Okay, fantastic. And so here the tape is cut into 5 millimeters. 5 millimeters in a space between each one of the strips. Because our objective is to work superficially, but we're going to be working on the skin. Because our objective of the treatment is to increase the compression of the receptors or to increase the dilation of the receptors. Dilation, okay? So what are the symptoms that we expect in this patient? We expect the symptoms to be pain, okay, edema, phantom pain. What do you do with phantom pain in medicine? Phantom pain is something easy to treat or very difficult to treat from medicine? Very difficult to treat. Instead, for us, it's very easy to treat. How come? We're applying a tape and apply a tape, which is dilation. So from a receptor point of view, we are applying a tape and it is increasing the space, increasing the tension around that scar adhesion. And pain very quickly goes down. This is the experience, this is where I met Singh. Okay. Where I met Singh the first time in Ethiopia. Okay, I don't know whether he told you. Okay, we had a project in Ethiopia. And so from Italy, I took, I think, 8 physical therapists and some doctors to the university in Mecca there in Ethiopia. Our objective was to treat phantom pain in amputated persons, okay, no longer patients, but persons, after the war, which was 25 to 30 years ago. They still have lots of symptoms, and the most debilitating symptom is phantom pain. And so we apply a tape over the area, and very quickly, 1 treatment, 2 treatments, 3 treatments, the pain changes completely. Because we are no longer using a compression technique, a bandage technique. It's not a bandage. Okay? You use a bandage when you have hemorrhage or when you don't have hemorrhage. When you have hemorrhage, you do bandage technique. Very quickly, you no longer have hemorrhage. And so we are applying a tape and we are creating that decompression force where the pain changes completely. So we have one work which was published, okay, out of that volunteer group. Okay, we'll look at that. It's not very high indexed, but anyway, it's a publication of their results. Okay, very interesting. And so this is an area for us to think about also in Malaysia. You have diabetes in Malaysia? Yeah, because you like to eat a lot. And some of you like to drink a lot, and smoke a lot, and drive a lot. Okay? Less mobility means diabetic problems becomes. Okay, so in all over Asia, diabetes is going to be a bigger and bigger problem. And so what is the consequence of diabetes? Ischemia, ischemic situation, okay? And so amputation is one of the big problems. So the World Health Organization has a big project which is aimed at reducing poverty by reducing amputation. Just like in Ethiopia, same in Asia, if you have a leg which is amputated, your working ability increases or reduces. And you are more likely going to be poor or rich. Poor. So our objective is to treat or prevent local congestion caused by eating problems, movement problems, okay, smoking, drinking problems, and diabetic problems, okay? Also, this is a big issue for Malaysia, okay? So, you see here, if you look at the tension around this stump, okay? This is the second treatment. So what do you notice between this is the second treatment and this is the first treatment? What's the difference? The yellow one is the second one, the blue is the first one. The yellow one is you have more mobility or less? More or less? Blue is less. You see, it's more open, more closed, more closed, open, closed, open. Okay, so consequently, there is more elasticity or less elasticity in the skin. More elasticity in the skin. More elasticity means more decompression, less constriction, and less pain. Physical therapy, what is your main objective in your patient? Main objective is pain reduction. If you use techniques and all of your patients leave your clinic or leave your hospital with no pain, okay, you're going to have the BMW parked in your garage, which means you are going to be very successful. If you reduce pain and increase function. Patients come to physiotherapy for that. Reduce pain, increase function. And so you need to have instruments. And you only have two hands. You only have two hands. And your hands do compression technique or decompression technique. Decompression technique. Your hands do decompression. And so you need assistance. Neuromuscular taping is your assistant to treat more patients and to treat bigger surface areas. Okay? So, these are diabetic areas, okay? Also this one, okay? Okay, what do you think about that? This is decompression technique up until here. What about this? Compression technique or decompression? This is compression, this is decompression. So the physical therapist sent me this photo in Italy, okay? Because he got confused. Okay? Because a part of his brain was telling him, compress, compress, compress. Has pain, so compress. A part of his brain. Okay, so he got confused, and so he put a top on it, or okay. He wasn't happy just with the single strips. His right side of his brain was telling him, put a bandage on that. And the pain went up. So he went against his right side brain analysis and constructed the left side brain learning skill and applied the single strips, and the pain went down. Sometimes we get confused because neuromuscular taping is a new system. Compression is a very new system or old system? Compression is very old. Decompression is very new. Decompression started in 2000 and started in Italy. Started with me in Italy. A decompression taping technique, which is a very new concept. Okay, so again here, this is a knee operation, knee replacement, very typical situation. And this is a typical application of tape. Single strips, medial, lateral to the knee. Okay, just like this. We have the knee going down to the ankle, and we're also going to be treating the ankle. Even this is a patient which I recently saw. Okay, this was a year ago, and this is a patient. Just a few minutes. This is a patient who had a motorbike accident and severely fractured his humerus. Okay, and so the surgeon put all the pieces back and put a metal rod right down the middle of the humerus. Okay, so he was alive. Okay, after the motorbike accident, everyone is happy, but consequently he had a upper limb paralysis. Okay, because what happened is the nerve fiber was severed, so consequently he had paralysis. So the surgeon came back and got a piece of his sciatic nerve and replaced the nerve. High-level technology, high-level surgery, excellent. Okay, but still has the paralysis. Okay, so how come he has paralysis? The nerve fiber has been cut but replaced. What's happening to the conduction? There's less nerve conduction, correct? So, to enhance nerve conduction in this trauma situation, what do we have to do locally? Compression or decompression? That nerve requires more oxygenation or less? Your manual therapy is like this. Up and down, up and down, up and down, up and down. Okay, creating more space, reducing the local compression, increasing fluidification and nutrition to the nerve fiber. Oxygenation. It's not just one treatment, it's 3 months of treatment. 3 months manually treating up and down, 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 up and down. 3 months. Or you apply a tape. You apply a tape, and who does the treatment? You do the treatment as well as the patient does the treatment. Okay? This was 1 year ago, and so you see the support on the hand. Also applying the tape, decompression on the hand. Because his hand is hot or cold? Cold, which means blood circulation is reduced, so we have to increase the blood circulation if you want it to work better. So very quickly he started to be able to get the pencil like this. He was able to coordinate his fingers. He has some deficit in extension of the wrist. But now he's a tattoo artist. Okay? So he's doing the tattoo. He's an artist with this hand. Took 1 year. So his quality of life is improved. He still has some difficulty, but highly different to what he was. Okay? If we did not treat him, he would still be in this situation with subluxation. Okay. So, sometimes you need lots of time in this very complex situation. Yeah. Okay. Yeah. Okay. You want to explain that a bit? Yeah. You have something to the paper? You have some paper or a sheet? You have a sheet? You use a sheet? Okay. Okay. So, okay. Yeah.
Wait, no detail. Just here only. upload.
Come on, later I put. You go translate. I cannot translate. What?
Dia untranslate what?
John had a falling accident. The left side brain. Okay. From birth. From birth.
Keep it here. Yeah. Keep it here. That is okay. Keep down. Turn it
Okay.
down.
Had an operation.
No. Yes.
We'll brief you about the baby. Just collect the history of the son.
Okay. How long ago you had the operation? Hmm? 2015. How old is he now? 4 years and 5 months. Okay. And so after the operation, did you notice an improvement? Okay. So improvement in what?
Can I can.
So I just put the pedals down.
Growing, starting to grow.
We don't need see ma.
I need to see.
Okay.
Let's see.
Yeah, stick on.
Let's see.
Okay, so there's more coordination on one side and the other side after the operation.
Who is this?
Okay. Can you, after the operation, is the sight better? Is he able to recognize you easier? His sight.
There will here we will.
Okay. So does he watch TV? He can see the images on the TV, you think, or just the colors? Okay. So, listen. Okay. So, what is your objective?
I want to.
Main focus is that removing or you could say that decreasing this capacity at present.
Okay.
Hello everybody. Actually, when we see the baby at first outside, so I don't have much history right now, but when I see the baby, my main target is reducing the spasticity because you can see the internal rotation, upper limb, and in the lower limb you can see the complete plantar flexure. Alright, so that's sign of rigidity or extreme stage of spasticity. So here, while applying the tape, we will focus like how we can reduce the spasticity. So all the joints will be relaxed and mobility can be increased. That will be the ultimate target. Even we will try to focus on this. So you can see the movements of eyes and position. So we will use some tapes where we can try to fix the baby's gaze. You can see the baby is not able to fix the gaze right now. So when we apply the tape, we will try like bringing these both eyeballs together in the center part. So that will also be our target here. At present, this is what we are focusing. Let's see how it is going to be.
Okay, fantastic. So, so in this child we have various situations. Okay, so so the child was born with a, I'm not quite sure what the pathology was. Okay, but had an operation. Okay, and after the operation there is some improvement. Okay, so it's important to have an objective. We have some rigidity in the foot, in the ankle, even though the child can release it, you have not a joint problem, but a muscle and tendon retraction problem. Okay? So in the lower extremity, you see the hands, how he is using the hands. Okay, the tendency is into flexion. Okay? Okay. Okay. So we're going to be doing a series of applications, okay, also on the forehead. So these conditions, okay, because we have a central nervous system problem, our first application is going to be on the occipital area, because we are going to be using a concept of bottom up. We can stimulate from bottom, from peripheral to central. Taping is not a central nervous system direct stimulation, but it is indirect. So consequently, we are going to be applying the tape as close as possible to the central nervous system, which means we're going to be applying the tape on the occipital area, which is as close as we can get to the cerebral cortex. And our objective is going to be constriction or dilation. It's going to be reducing blood circulation or increasing blood circulation. Increasing blood circulation. Okay. So we're going to be using a tape. Okay. Usually we're going to be using a neutral. Yeah. Just try and when I do the application, come in.
Yeah.
Okay.
You pick one model in every table. Alright, one model in every table, and you will try to copy what is right. Okay? You will come in between and you observe how you are doing it. You will correct your mistakes. Alright?
Okay.
So please make yourself ready with the model in the couch.
Okay. So I'm just going to apply tape. Okay. You've already applied tape? No. Okay. And so we're going to be applying the tape in the neck area. Okay. Okay.
So together with your competence.
Okay, so first thing, I just want to get a close-up of his eyes.
Models ready. Models ready on the couch first.
Just look at the eyes. Okay, just look at the coordination of the eyes. Okay, so you see the pupils of the eyes are not coordinating, okay, like this. So they're slightly strapping internally. This.
Focus here.
In the tape cutting.
Please observe how the tape is cut. There is a special only cut. So it's not easy. Get closer.
Okay, so we'll be doing this as a practice application immediately afterwards, okay? So in this case, the tape is cut into 6 millimeters. This is 6 millimeters, as you see here. Okay? This is 2.5. This is cut into 4 strips, which means 6 millimeters. So we just need to clean. Okay, and we'll be applying 4 strips over the occipital area. Okay, so the objective is to apply a tape. How do you create decompression? And the application is going to be, can I get you just to hold the head like this, okay? And head has to be in a flex position, okay? Yeah. And going down, okay? Yeah. Yeah. Yeah.
Isa pala.
Okay. Let's get the tape on his hand. Yeah. Okay. Okay, pediatric, the difficult aspect is to apply the tape. Okay, you can even apply tape on the mama, on the mother. Okay, if you see it, maybe it's not going to see it. Right? Okay, so we need to put the skin into a stretch position. So the head has to be in this position. Okay, so again, yeah, so in.
Yeah, okay. Good. Yeah. Okay. You just make her sit here. Sit here. Make her sit. Make her sit.
Okay.
Sit here. Now you talk to her. Talk. Stay in front of her. Stay.
Yeah.
Down. Yes. Good. Very good. Yes. Good. Yes. Good. Focus here. Very good. Done. Very good. Good. Very good. Done. That's all finished. Abby.
Okay, very good.
Good girl. Girl or boy?
Good boy.
Boy. My mistake.
Okay. Good contact again.
You take this. Okay.
Okay.
There's so many people around.
Okay.
Okay. Good. Okay. All right.
Okay, we'll come back.
Just relax. Okay.
Just relax.
Just relax. So, practically how it is difficult. Theoretically it looks so easy, but practically really the big challenge is to convince a pediatric specialist. It's all about confidence, no trust motion. I don't believe you.
Okay, so the difficult part is to apply the tape because children have very fine hair. When you apply the tape on the skin, they will very quickly feel it. And so consequently, they will go into contraction like this. So, we have to apply tape, we just have to wait. Usually a child is going to get used to it, okay? And then we're going to come back. Otherwise, we're going to just keep on going. We're going to do something different, okay? And so, one of the standard applications is going to be on the extensors of the fingers. Again, feels the tape. Yeah, maybe if you can, you want to sit up here?
Here. Okay, done. inches. Yeah. Flexion. Okay, done.
Okay.
Nothing. Good. Very good.
Yes.
Yeah.
Okay.
Good.
Wow. What's your hand? Oh, really?
You see, he's looking now.
Okay.
Good. Yes. Good. Very good.
Excellent.
Very good. Okay.
Okay, because the tape is proprioceptive, so the person is going to feel the tape. The tape. Okay, so with pediatrics, we have to have a very soft approach, okay, step by step. Have to create some confidence with the child as well, okay. Usually applications where the child sees it, okay, you're going to be using a colorful tape, not because the color has different chromotherapeutic action. No, it's not like that. Okay, it's just because they're going to recognize a certain color and to perceive the color and the stimulus. Something is going to change in their perception of the hand. This is our objective, okay? So here, our objective is to apply a tape which is going to create decompression and it's going to, just a little bit more inflection. Okay, so you see how we're applying the tape. We're applying the tape, inflection.
Good.
Okay. Inflection. Okay, so we have to create the wrinkling action. And so how do you create the wrinkling action? Okay, so I just want, as we're applying the tape, just to observe how he is using the hand. Okay, what is the tendency? Because he doesn't have a real spasticity, has a tendency of the spasticity. Okay, because you can see he can completely extend his wrist and fingers. It's a question of how he uses it. Okay, okay, but just notice the difference between one hand and the tendency of the other, and we're going to apply it on the other side. And so, okay, step by step as we go. Okay, because we want the child to have, okay, the normal. Okay, and so what you notice is that,
Good.
okay, if I put a tape on your neck, you'll feel, oh, like this. And she will have the same reaction as he will. Okay, so it's a question of applying. So we have to get back to the neck. So let's just try the neck again. Try the neck again.
You sit down.
Yeah.
Just sit. Sit down and talk to your baby. Just talk to your baby.
Head down.
Look at mama. Look at mama. Look at mama. Good boy. This is how we communicate with the patient even we don't know the language. 5 years. I don't know the American Tigrinya. What do you remember? We don't know the language, but we communicate with every patient and really we talk for hours without knowing the language. So language is not important. The only thing is intention is important. What you wanted to do. Yes, yes, done. Very good. Good boy. Good. Very good, very good. That's all. Over. Finished. Good. Very good. Say hi to everybody. Say hi. Abhi, say hi. Very good. Sitting.
Okay, so just notice the tendency of one hand and the other hand. Okay, just the tendency. Okay. Okay, because usually one is in a sitting position. And how's their hands? Your hands are like this, yeah? Hands are like this, just like this green hand. Okay, this positioning of the hand here, hyperextension of the elbow, considered a not correct positioning. Okay, so just a child has central nervous, so we want to create an input which is going to normalize the position and repeating and repeating and repeating over time, which means you're able to modify the proprioception and modify the automatic movements of the body. Okay. Okay. You see the left hand. The left hand is pretty much in a normal position when you put it. Okay.
Yeah. So that's what it is. Speech is also affected. Speak something. Any word? Little. Yeah. So, no problem.
Okay. Okay. So that's just good.
Good. Very good. Just see this.
Very good.
Good boy.
Excellent.
Good boy. Very good boy. Wow. Colorful.
Tired. Baby tired.
Yes. Very good. Good. Shabash. Good. See this. See this. It's attractive.
Cut some more tapes, 6 millimeters.
The same.
Yeah, the same.
You got another scissor. Yeah.
Baby tired.
Good boy. And it's over.
Baby
Yes. Done. Finished. Very good. It's done. Finished. Good. Okay, again. Yes. Good boy. It's done. Very good.
Okay, so just giving.
Okay. Finished. Finished.
Okay, I'm just gonna close up of the ring thing.
Yeah.
of the tape. So.
Tired.
Good.
Baby tired.
Yes. Finish. Done. Over. Okay.
Be quiet.
Oh, okay. Finish.
Hala.
Finish. Good. Very good. Finish. You show to everybody. Very good. Just show everybody. See how it is looking. You see? Yes?
Okay, no, that's okay. Just have to finish that.
Just show to everybody.
Where's the mine on it?
Very good. You have to make him sit in the corner. In the corner, in your home. Make him sit in the corner. Wall support. See? On this. And this will go. Without compliment.
Okay, so we're just going to apply the tape on the thumb, on the extensors and flexors of the thumb. Okay, but generally speaking, we see the hand is starting to become more softer. Okay, it's easier to put into a neutral position. The fingers are going to be more open. Okay, more similar than what they were before. So now we're just going to apply tape of the flexor ductor aspect of the.
Okay.
Finish.
Finish. Yeah. Good. It's finished.
Hala.
You see? Good.
Okay, so because the hand goes into flexion, okay, so we have to apply the tape first on the extensors. Then we're going to apply the tape on the flexors. So we're just going to concentrate on the right hand because it has slightly more problems on the right hand than the left side. Okay? Okay? And so with the flexor on the thumb,
Yes. Finish. Okay.
Isa pala.
Okay. Finish. You finish. Good.
Isa pala.
You finish.
Yeah.
Okay. Done. Is done.
Isa pala.
Yes. Over. Finish.
Okay.
And finish. You see?
Okay.
Hala.
Okay. Just wait.
Good.
Okay. Just want to come around the back. Okay. So you just see here on the back, okay, as we have the time delay.
It's okay.
Time delay. Because
You
you
want to
see
pull this
here.
up?
No. Okay. Because you see here, 3 tapes are wrinkling and 1 tape is not wrinkling so much. Okay, you see the first tape, we had more difficulty in the application of the tape, so consequently the tape was applied in extension when it should have been applied in flexion. So consequently we have to take that one off. And the problem is always taking the tape off for children. Because we have to substitute this one here, so
Good. Okay.
Okay.
Done.
Okay.
Hãy cho mình đất này nè, hãy cho mình đất này quý 15 để sẽ được thành công.
Very good. Yes. Finish. Yes, and it's done. Okay.
Okay, very good.
Done. Okay.
So now, okay, you'll see with the photo, now all 4 strips
Focus here.
start at the same point and finish in the same point.
Eating.
Okay, so that's how we
Okay.
evaluate. When we do a treatment, it has to start in the same point, finish in the same point. If they are all different lengths, then the stimulus is going to be different. So it has to be a constant stimulus, decompression stimulus. Okay. Okay, so we're going to apply the tape over the forehead.
Should we lie down?
Yeah, okay, so let's just,
Sit straight, yeah?
okay, so also we have very low. Okay, so I'm just going to cut the tape. Okay, the length is going to be calculated from the hairline up until the eyebrow. Okay, so our objective is to apply the tape over the forehead. And so here it is going to be 5 millimeters. 5 millimeters. So it means 10 centimeters you have to cut into 10 strips. So our objective is to create a decompression force on the forehead. The objective is to encourage blood circulation to the forehead area, also on the temporal aspect. So if we create a dilation pumping mechanism, more oxygenation to the superficial skin and muscle fiber around the eye, which from clinical experience assists in child focusing. Okay, so you can pop this one. Okay. Yeah. 5 strips. So just notice the hand, okay, the right hand. The right hand, even though the mother is holding, you see the difference in the positioning of the right and left hand? They're pretty much...
Previously it was here, an extended position, and now it's relaxed. You look so funny, huh? You can't, if you don't love your patient, it's difficult to treat. Sorry? Do it.
Okay, so there's still a little bit of difference between one side and another side, fine. Okay.
That's the most important part of the paper. How you
Okay.
cut the paper.
It's a little bit different, but it's easier for the child to position the hand, okay? So we have conscious movements and unconscious movements. So the tape is working on which level? Conscious or subconscious? It's working on the unconscious aspect of our movement. Okay, so we're going to get lie down. We're going to try and lie down.
It's okay, I think this is okay if you no problem for you.
Yeah.
Okay. Okay. Alright.
Okay, we just need to
That's
clean
all.
and then very quickly.
Yeah, that's it. Just hold it here. Hold the leg. Okay. Finish. Okay. See here. Okay, that's it. Let's go. Okay. Okay, finish. No. Okay, finish. Very good. Okay. Okay.
Okay, so just get a close-up of the tape, which is
Alright, very good. Next. Okay. Ready? Hold the leg. Okay. Done, finished. Very good. Okay. Okay, done. Finish.
okay. A little bit short.
Good.
Okay,
Okay, finish. Relax.
Okay, so we're on the other side.
Oh, wait. Yeah. Okay, finished. Finish. Okay. Good. Finish. Done. Okay. Good. Finish. Leave. Okay. Relax. Okay. 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 Done. Finish. Okay. Well, finish. Okay. Okay. Done.
Okay, so we need some 5 millimeters, which is a little bit longer.
Okay, finish.
A bit longer up until here, just for the temporal aspect.
Alright.
Okay, so we're on the opposite side.
Okay. Finish. Okay. Okay. All right. All right. All right. All right.
Okay, nearly finished, then we have to break.
That's all. Only one. That's all. Finish.
Just the last one?
Finish. Finish. Okay. Finished. Finish.
Okay.
That's all. Okay. Good one.
Okay, you have to take some.
Wonderful. She's looking. Will apply in the lower limb also later on.
Yeah. Okay, change hands. They're very democratic.
Yes, you can.
Okay, I'm going to sit. Do I sit? Okay.
Please. Let us sit there. Come.
Okay, so we're going to cut the tape at 6 millimeters for her, which means cutting the tape in half, and in half.
Come close. Come close. Please come. Come close. Sit down. Just observe. We'll go for practical.
Just look at the focusing of the eye. Just observe the eye. Yeah,
Pull down when beginning.
yeah. Yeah. Lift up your eyebrows. No wrinkles.
No wrinkles.
No wrinkles. Okay, relax. Okay. Okay, the methodology. Okay, methodology is the key. How do you apply the tape? Okay, so you have this segment on the forehead, and the skin here is elastic in what direction? The skin is elastic in what direction? Like this, or like this? Up and down, this direction. Okay, so we're going to apply the tape just on the medial border of the eyebrow. Okay. Then we're going to stretch the skin with my thumb, index finger, stretch. Stretch the skin, not the tape. Stretch the skin. Stretch the skin, not the tape. Okay? Okay, the tape is 6 millimeters wide. We're going to leave between 5 and 6 millimeters between one tape and another. Okay. Okay. Just feel like this and feel like this. Softer on what side?
This side is more soft.
Are you sure?
Yeah. That side is soft.
Which side? This side or that side?
This side is soft.
This side is soft.
This side is harder.
Okay. Yeah. You feel the same? Okay, so we're going to be doing this as a practice. Okay. So the trick is to maintain the skin in a stretch position and you apply the tape no stretch. So we're not going to put the tape on the hair, okay, but it's just over the superior border of the eyebrow up until the hairline. And we're going to keep on going up until the temporal border. So, you need glasses for reading or for long distance? Short distance or long distance? Focusing. You need glasses for short distance or long distance? Long distance. And so when you read, you use glasses? Yeah? Okay. Okay. Up and down. Up and down. Up and down. More, more, and down, and down, and down. So we need to activate the tape. So we're going to be doing it manually. Okay, so if you have, what are some of the conditions that we can use this for? What sort of conditions? Bell's palsy, okay, from viral, or from cold, or from central nervous, okay, so it is still peripheral stimulation, okay, so our objective is to increase the oxygenation to the facial nerve. Facial nerve is going in this direction or in this direction? Facial nerve is like this direction, but the skin is elastic in this direction. So you follow the nerve or you follow the skin? You follow the skin above your objective. Okay, so again, up and down, up and down, up and down. So together with the patient, you are going to activate the tape manually, together with their input, okay, even though they have difficulty in up and down, up and down. Not only those with facial paralysis have difficulty, also normal people have difficulty. Up and down. Okay, so the activation. So you see already in a neutral position, it is softer. Correct? Oh, sorry. Okay, so you can touch here, and touch here. Touch here. Touch here. And touch there. No? You don't feel the difference? This side is softer. Yeah. Yeah, and then outside. Okay. Yeah. Okay. Okay. What we also have to apply on the child is the lateral or temporal aspect, okay, which is going to be up until just in front of the ear, tragus of the ear, okay. So this is the length of the tape. And so again, we're going to be cutting the tape into 6 millimeters. So for an adult, it's going to be 6 millimeters, 5 millimeters. For pediatric, it's going to be 3, 4, or 5 millimeters. So depending upon the size, okay, because the width of the tape depends upon depth of action. The width of the tape, depth of action, okay? So here we're working very superficially, which means the tape is 6 millimeters. I'll just cut this back.
6 millimeter.
Yeah. This will towards me. Okay. Just like this. Yeah, just hold your hand like this at the top. Okay. So I have to stretch the skin down. Okay, stretch the skin between your two fingers. Yeah, just a little bit shorter. A little bit shorter? Yeah, this much shorter. Yeah, that's it. Okay, so this is a temporal and forehead application. Okay, and relax. And so you see here how the tape is also there. Okay? Okay, so this is a standard application we're going to be using. Facial paralysis, Bell's palsy, autism, deficit developmental conditions. Okay, so if you have Bell's palsy, you're going to be using bilateral or monolateral. Mono, one-sided. When you have developmental situation and post-surgery, we're going to be using it bilateral. So for CP, we're going to be using it bilateral. Okay, CP, we're going to be using it bilateral. So if we want to work on the focusing capacity, always bilateral. Forehead and temporal aspect. Okay, you want to put your glasses on? So, yeah? Okay. Yeah. Yeah. You need to just finish the application on that. And then you also have to apply the tape. Also, lumbar. So this that's That's what we have to choose. Yeah. No. There's another one is actually comes up.
Where to play?
Oh, very good. Very good. Good. Good this side. Okay, okay, okay. Finish. Finish. Okay. Okay, 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 okay. Okay, 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 okay. Okay, finish, finish, finish. Finish, finish, finish. Okay, okay. Okay, look at mama, look at mama, look at mama. Okay. Okay, finish, finish, finish. Okay, done. Finish. One more, one more, one more. One more, one more. We are done. Yes. Okay. Okay, finish. Okay. Okay.
Okay.
Done. Finish. Yes. Just relax, relax.
Okay. Okay. Okay, so just getting close up on the eyes and
Yes.
okay, so upper extremity, lower extremity. Okay, so just getting a close up of the eyes. Okay. Okay, so is something happening or something is not happening with the eyes? Okay, something is happening. Okay, just observe the eye focusing capacity. Okay, it's fixing the focusing. Okay, for a bit longer period of time. Okay, that eye is less irritated. That is also something which could just happen by itself. Okay, if you have inflammation, you increase the oxygenation and drainage. The inflammation is going to reduce. Okay.
Regarding this, I wanted to add it, David. Actually, we are conducting on research on this visual acuity. So right now, to fix the gaze, we are in process of data collection. And for your information, I'd like to tell you that really we are getting tremendous result in this. Babies, the gaze fixation is really improving very nice. The babies, which I told you, maybe some of you have attended my class in pediatrics, where I was talking about fixing the gaze, yeah? So like when you try to fix the gaze, baby will look and it will be dropped. They will not be able to focus continuously to whatever the object is. So this is called, there is a defect in visual acuity or gaze fixation. This quality is improving with this taping mechanism. Soon we will have published, and I will let you know, all of you.
Okay. Okay. So what we just noticed observing the child has less erratic head movements, more controlled gazing. Okay. Seems as though he's able to focus better. Okay. So next application is we're going to go to the lower extremity, and so we're going to be using two tapes like this. Okay, we're going to be applying it where? In the lower extremity. So for the upper extremity, we're talking about the occipital area and then the arm. Okay, so for the lower extremity, these two are going to be lower back, sacral plexus. And we want to open the door or close the door? Open or close? We want to open. Okay. So the first two strips have to be not over the spine, but just beside the spine. Our objective is to encourage the muscle functioning, okay, and to reduce any sort of retraction, muscle contraction. So, yeah. No, sit.
You sit down? Now? You sit down. Yes, sit down. So just focus on the back. Please observe the back, baby, if you can see. Just a minute, hold on, David. Just wanted to
Okay.
show the back.
Excellent.
Yeah.
So here the width of the tape is 3 centimeters. 3 centimeters is the correct width for this child. Okay? Adult is 5 centimeters. So if you start at the same point, you're going to finish at the same point. Start, finish. Okay? And so when it comes up,
Yeah.
okay, so you see
Here,
how
here,
the
record.
tape, see how the tape is wrinkling like that. Okay. Okay, so if we want the child to be crawling better, okay, the coordination, we encourage
More stable.
one knee, one hip flexion, okay, followed by the opposite, the coordination, correct coordination of one or the other. We have to start in the lower back, okay. Next application is going to be over the Achilles tendon gastrocnemius. So we want to apply tape again. You touch the tendon and it's going to be soft or hard? Hard. In retraction, correct? So we want to apply the tape, which is going to create hardness or softness. We have to use opposites, correct? Okay? So if something is already hard and you use a bandage technique, okay, there's no reasoning there, correct? Okay, so we have to use opposites. Okay, so let's take a measurement from the heel up until the popliteal fossa. So again, if the lower back is going to be 3 centimeters, that is going to be our basic width of the tape. Okay, so we have to cut 3 centimeters. So, okay. And so this is a typical gastrocnemius application. Concentric, eccentric, eccentric. So the tape is going to be cut into this way, okay? Which means this is 3 centimeters, this is 1.5. Okay, so which is going to be working deeper in the body? This one or this one? Deeper. This is working deeper, this is more superficial. Okay, so which is softer? Gastrocnemius muscle or Achilles tendon? Which is harder? This is gastrocnemia. This is gastrocnemius muscle. This is tendon. Okay, so it's not going to be like this, yeah? It's going to be like this. So the form of the tape is a mirror of the anatomy, okay, and of the functioning anatomy. Okay, so can we get the child to lie down the stomach? Do you want to go along now?
Yes. Yes, very good.
So obviously the flexors are going into retraction, okay? So we need to apply the tape.
Slow. That's all.
Okay.
Mind stretching, not more. Yeah.
Okay, so we're going to get to a physiological range of movement.
Okay.
Just hold here.
You hold it standing here. Yeah.
Okay,
Okay.
and then we need to stretch the muscle fiber Stretch the muscle fiber and stretch the skin above the muscle fiber. Okay, okay. And so, just come on. Okay, so you see when the child goes into flexion, okay, the tape is wrinkling, and the wrinkling means eccentric action.
Where you find the wrinkles, it will be softer. Where it is not wrinkle, it is hard.
So this is going to be obviously a bilateral application, okay, for the child, okay, because we have both sides equally affected. So if it is bilateral, both applications have to be exactly the same, okay? Not one which is longer, one which is shorter, okay? So in flexion, in correction. Stop. Yeah, okay. Stretch the skin where possible. Done. Okay, nearly finished. Okay. Okay. So when we
Lift. Just hold it, yeah? Just hold
okay. Okay. Take concentric, take eccentric. Concentric, eccentric. Concentric, eccentric. So the tape is intelligent or stupid? Tape is intelligent or stupid? Stupid. Because the tape does what we tell it to do. Okay? Okay? So give your forearm forward. Okay, so I think we're going to finish with the child today. Okay, we're going to finish today. Okay. So we want the tape to stay, okay, for 1 day, 2 days, 3 days, maximum 3 days, and it has to be reapplied, correct? Okay. So if the child can wash, we can have a bath. Okay, you want to explain? Can have a bath. Okay, tap dry, use the hair dryer to dry,
โยงให้
not
ไดร์
rub
เคลีย
like
ร์กัน
this.
เนาะ
Okay,
เคต้านสันเทียน
okay. Also on the neck and on the face, try and keep the tape for as long as possible.
就是沿着哦
3天.
3天就要脱掉
Okay, and so I just want the parents to observe the focusing capacity of the child and whether the child really watches TV or not.
还要你们注意看说他会不会他眼睛有没有在注意看着电视机啊之类这样子的东西
Okay, and so when you call from a distance his name, see if the child can see you or doesn't see.
就他你比如说你叫他名的时候看他会不会这样转过去看你一下这样子看他 response 怎样
Okay, okay. So thank you for coming. Okay, okay. Okay. Bye-bye. Okay. Okay, so obviously the tape is not going to last for a long time. Okay, so physical therapy is not magic. It's not magic treatment. Okay, but it is the correct treatment, and what is gold in physiotherapy? Repetition, 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 repetition. Okay.
Take like 10 minutes.
10 minutes.
Okay, after this.
Okay.
And then we'll go for
practice. We just observe everybody
Yeah.
how they are doing.
Okay.
If you are agree with yeah.
Yep, perfect. Okay, so I just want to do a demonstration, then we have a 10-minute break. Okay, and then we get into some practice. You all have tape. You have some tape? You all have pair of scissors, yeah? Okay. Okay, so this is 2 tapes. Same length, yeah? Just do like this. Do like this. Yeah? You have no problem. Okay. Okay. Just observe. Okay, just watch. Just watch. Okay? Okay? Compression or decompression? Of course, the tape is longer than the paper, which means stretched or no stretch? Very good. And no wrinkle. No wrinkle is, yeah, just do like this. Also flexion of the elbow. You feel it's facilitating your movement or not facilitating? Is it heavy or light? Yeah. Maybe heavier, yeah. Okay, just look. Stretch muscle, stretch skin. Just keep that. Okay. Stretch muscle, stretch skin. No tension. The tape is shorter than the paper. How come?
Because we didn't apply any compression.
Same length, yeah? Same length. Ah, so wrinkles. Wrinkles. No wrinkles. Okay, so when you do a WhatsApp, okay, wrinkle, good effect, no wrinkle, negative effect. So you do like this. Which side is lighter? Which side is easier for you to do? Yeah? So one of these is working concentric, one is working concentric. What's happening? Okay, so let's just finish this and then we'll have a break as well. Okay, so one of these, I stretch the tape. Stretch the tape. If you stretch an elastic, the elastic fiber comes back concentric. So this is concentric. Concentric, 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 concentric. So is it harder or softer? Okay. Softer. Harder. Okay. Whereas this one, we apply the tape in extended position, and the tape is working eccentric, 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 concentric, stretch, eccentric, pushing, pulling, pushing, concentric, eccentric, pushing and pulling. Which one uses the elastic fiber in the tape? There's only one technique uses the elastic fiber. Left side or right side? Left side. You stretch, come back. This side is not stretch, but it is pushing. Okay? Which means eccentric stimulation, elongation. Okay? So even if you move, you'll be like Even for her, we didn't evaluate before, but this side is easier or this side is easier. Do you want which side has bigger range? Yeah. Which has bigger range? More open. Okay, exactly. Okay, 10 minutes break. Okay, then we come back.